Okay, let's jump straight in. Welcome to the deep dive. Today we're talking about something small, but really crucial. Your thyroid.
The little butterfly-shaped part in your neck?
Exactly. It controls so much, like your energy, how you use food, your metabolism, basically.
It really does. And we're going to unpack why keeping tabs on it with a blood test is so important.
Yeah, and we're using a great guide from the Blood Test UK website for this.
That's right. A really comprehensive source.
Our mission today, simple language, big benefits of testing, and crucially, where you can get these tests done right here in Norwich.
Let's do it. Because, sometimes thyroid issues can creep up on you, feeling just like you're tired or stressed.
Right. So maybe you feel okay, generally speaking. Why get tested then? What exactly are we even looking for in these tests?
That's a perfect question. Because the symptoms can be so subtle. Being proactive makes a real difference. The test mainly checks your levels of certain hormones. You'll hear about TSH, T3, and T4.
Okay, TSH, T3, T4. Break that down a bit.
Sure. Think of TSH, Thyroid Stimulating Hormone, as like the manager. It comes from your brain.
The manager, okay.
Yeah, and it tells your thyroid, the worker, to make T3 and T4. Those two are the ones actually doing the work around your body.
Got it. So if the manager TSH is high on the test result, what's that telling us?
Good question. High TSH means the manager is basically shouting because the workers, T3 and T4, aren't responding enough. So high TSH usually points to hypothyroidism. That's too little thyroid hormone.
And that's the one that makes you feel tired, maybe gain weight.
Exactly. Fatigue, weight gain, feeling cold, those kinds of things. And the flip side.
Low TSH.
Right. Low TSH suggests the thyroid's gone a bit rogue, making too much hormone. That's hyperthyroidism. You might lose weight without trying, feel anxious, have a really fast heartbeat.
Okay, so knowing is obviously important. But what are the sort of ongoing benefits? Say if you already know you have an issue.
Well, that's where testing becomes absolutely crucial for management. Early detection is benefit number one for everyone. It stops small issues becoming big ones, like serious heart problems or bone weakness later on.
Right.
But benefit number two, if you are on medication, regular testing, say every 3 to 6 months, is key. It helps your doctor fine-tune your dose, keep it just right.
So it's about staying optimized, better energy, mood, weight control.
Precisely. It's about feeling your best day to day, not just avoiding major problems, constant calibration, as you put it earlier.
Okay, that makes sense. So if you need this test, maybe regularly you need easy access. Let's talk Norwich. Where does the Blood Test UK guide suggest people can go locally?
Norwich actually has quite a few good options. For routine checks, you've got local GP clinics. Places like Norwich Medical Practice, Colney Health, Broadland Medical Practice too.
So familiar places feels like a normal checkup.
Exactly. Makes it less daunting.
What if you need something more, maybe specialized? Or you just want results faster?
Right. Well, for more in-depth stuff, there's the Norfolk and Norwich University Hospital. They've got the advanced diagnostics. But if speed is what you need, the guide mentions private options are available.
Oh, like walk-in places?
Sort of. Places like St. Stephen's Pharmacy or the Health Clinic Norwich. They often offer private tests. And the big plus is you can sometimes get results back really quickly, maybe 24 to 48 hours.
Wow, that's fast. Okay, quick advice then. Before you go for any thyroid test, what's the one key thing to remember for preparation?
Prep is definitely key for accurate results. Fasting is usually needed, just water, no food, or other drinks beforehand.
Okay, fasting, got it.
But the really critical thing, you absolutely must tell the person taking your blood about all the medicines and supplements you take, especially biotin.
Biotin, like the hair and nails vitamin. Why is that such a big deal?
Yes, exactly that. It's a huge deal because biotin can seriously interfere with the test results. It can make your T3 and T4 levels look falsely high, like you have hyperthyroidism when you don't.
Whoa. Okay, so that could lead to a totally wrong diagnosis.
Absolutely. Yeah. So the advice is usually to stop taking biotin for a few days before your test. Always tell your clinic about it. Be upfront.
That's a really important detail about such a common supplement. Thanks for highlighting that. So we talked about TSH, the manager hormone. If it's shouting high or whispering low, what numbers are actually considered normal?
Generally speaking, the standard range for TSH is somewhere between 0.4 and 4.0. Those are the units MIUL.
0.4 to 4.0.
But, there's actually some debate. Some experts think that upper limit, 4.0, might be a bit too high. They argue maybe it should be closer to 3.0 or even 2.5, suggesting some people might be borderline underactive and not getting treatment.
Interesting. So a number outside that 0.4 to 4.0 range is basically a flag. Time to talk to the doctor.
Exactly. It means more investigation is needed. It's the start of a conversation, not necessarily the final answer.
Okay. This has been really clear. Being proactive about your thyroid health isn't just about finding a problem. It's more like ongoing maintenance for feeling good, using the resources near you.
That sums it up perfectly. It's about optimizing your health. And that brings up a final thought, really, for you listening. We know things like diet, stress, even sleep can influence your thyroid hormones. So the question is, how often should you be thinking about getting checked? Even if you feel, generally fine. Proactive testing could be really valuable.
Food for thought indeed.
Yeah. For more details and that full guide we mentioned, definitely check out the Blood Test UK website. They've got loads more information.